Emergency or not, pox still a problem for some, pox continues to be a problem, reminded Mayara Secco Torres de Silva, MD, and public health officials expect the disease to continue to be a problem, especially in June during Pride events. As of January 28, 2024, Brazil reported around 11,000 cases of confirmed Mpox, 16 deaths and another 349 probable cases, according to Dr. De Silva, who presented data at CROI 2024, about a recent Mpox outbreak in Brazil, Abstract 198. Although the World Health Organization ended the Mpox emergency in May 2023, Mpox hasn't gone away, Dr. De Silva said. Our results emphasize the crucial need to enhance continued surveillance strategies to promptly detect emergent STIs, sexually transmitted infections, within the context of HIV care and prevention services. As community transmission advances, people living with HIV who are not engaged in HIV care, both late presenters and those who are lost to follow-up, might be increasingly more affected and vulnerable to severe courses of Mpox, she said. Researchers out of Rio de Janeiro found evidence of an emerging second outbreak of Mpox in the city. Since late September 2023, we have observed a steady and progressive increase in Mpox diagnosis with 117 persons with confirmed Mpox until January 2024, Dr. De Silva said. They compared the characteristics of people with confirmed Mpox in the second outbreak with those in the first and saw similarities, but also notable differences. So far, individuals self-identifying as Black or Pardo, an ethnic and skin color category used by the Brazilian Institute of Geography and Statistics, and from lower educational backgrounds have been disproportionately affected throughout both outbreaks, she said. Black/Pardo, 234, 60.1%, versus 79, 68.7%, primary school, 232, 58.1%, versus 70, 60.3%, secondary school, 32, 8%, versus 6, 5.2%, post-secondary school, 135, 33.9%, versus 40, 34.5%. The second Mpox outbreak affected mostly cisgender men between 30 and 39 years old, and there were fewer reports among cis and transgender women compared with the first outbreak. However, most cases continue to occur among MSM, especially those reporting more sex partners and anal sex in the 30 days prior to symptom onset. The researchers also saw a higher percentage of people with HIV or who were taking pre-exposure prophylaxis in the second outbreak than the first, as well as a higher prevalence of concomitant bacterial STIs, especially syphilis and hepatitis C virus, according to Dr. De Silva. Altogether, among the 306 participants diagnosed with Mpox and also living with HIV during both outbreaks, about 15% had HIV viral loads higher than 200 cell counts/ml, whereas 13% had CD4 cell counts below 350 cells/mm3, evidence of an advanced degree of HIV-related immunosuppression across outbreaks, Dr. De Silva said. Because the new cases followed a period without signs of sustained transmission, Dr. De Silva said clinicians may have had a lower threshold of clinical suspicion for Mpox. The American experience, continuing Mpox, is also happening in the United States, including New York City, where Mary Foote, MD, MPH, is the medical director of the NYC Department of Health and Mental Hygiene. We have definitely seen an increase in cases over the past few months in New York, but the overall numbers are still low, she told Infectious Disease Special Edition. However, if providers aren't looking for it, they might not diagnose it. Although greatly diminished, the United States is still seeing Mpox cases, confirmed CDC Senior Public Affairs Officer Tom Skinner, of the National Center for Emerging Zoonotic Infectious Diseases. As of March 26, the CDC has reported 511 cases of Mpox in the United States and its territories this year. Because of ongoing transmission, we are gearing up for a busier summer this year compared with last, Dr. Foote said. The city is planning public health campaigns geared toward providers and the community over the next few months. However, they don't expect the public health emergency seen during the first outbreak because so many of those at high risk in the United States were vaccinated or previously infected, so disease should be milder for many this year. Vaccination is still being encouraged and recommended for those at highest risk from pox in the United States, Mr. Skinner said. This group includes MSM, transgender, gender non-binary or gender-diverse people, as well as anyone who has sexual or intimate contact with someone who might have pox, regardless of their sexual or gender identity,